We recognize that when a patient and their family are faced with a new diagnosis of cancer, their world is turned upside down, and there's all sorts of anxieties and stress that surround such a diagnosis. So recognizing that, we think that it's not only critical that we're able to offer them innovative therapies to give them a chance to live longer, sometimes be cured of their cancer, but also speak to them in a way that gives them that hope. Do it in a very genuine and sincere and compassionate way. In fact, every patient needs to be approached with that same perspective.
It's one of the things that I appreciated most about Dr. Winter is he treated me like a person, not a patient. We had a conversation about what the test results were, what my options were, what choices I had, and I think throughout the entire process, he's been extremely communicative and allowed me to feel comfortable bringing up issues and being part of my care. I've felt from the beginning that my job is to help him as much as his job is to help me, and I think through this process, that would be true.
I do form close relationships with all my patients. We have a saying at Seidman Cancer Center of like our own, which means like our own family. What does that really mean? Well, I really do consider patients an extension of my own family. I want to give the patient a chance to ask all of the questions that they have, and then they get my email and my phone number so that they can follow up with additional questions down the road if they have them, and inevitably they do. But I think the most important component of this is to be able, in the same conversation, give them both hope and a realistic understanding of what their cancer diagnosis means.
His head nurse, Tina, called me almost every day after surgery. And they both said, call me anytime. And I have. I mean, texting, technology. I would text photos when my infection was bad. We were keeping track of it together. I've had a sense of calm, I think, knowing that I've got a good team around me and they're making good decisions and they're listening to me and what's going on. So it's allowed me from a stress standpoint to be relaxed and focus on my care, not focus on the details of this or that. And I'm not sure that everybody feels that.